Welcome to Foundations with Larisa Hovhannissian, an unfiltered podcast where I explore the foundational principles of creators, entrepreneurs, scientists, public figures, and all around awesome people who make things happen. Today, my guest is Dr. Lorky Libaridian, a United States board-certified physician in both internal medicine and pediatrics with over 15 years of experience. She has a strong background in health systems, improvement, reform, and healthcare education in both the United States and Armenia. Dr. Lorky is passionate about lifelong learning and is very committed to enhancing primary care systems, especially in pediatrics, to promote a healthier population and country for all of us. Join me in my conversation today with Dr. Lorky. Lorky, thank you so much for being here today. I have tried to create a space where I get to talk to really interesting people like you and others who are, really successful in their own sort of domains, but are here and are more open to talk about not where they went to school and what they did and all these technical things that I think we usually talk about to get to where they are now, but really about the routines, the foundation, sort of the mindsets and principles that they live by every day to not just be successful in their careers, but just to, take as much out of life as possible and just be happy, purposeful, not always happy people. So with that, I really want our audience to get to know you because I think you're an incredible woman and an incredible professional. But maybe before we sort of get into those details, I really want to understand why you made the move here, because you were in the US for a while, you built your whole life there. And then all of a sudden you decide to move to Armenia with your child. And how's that going? I mean, you've been here for some years now, so let's start there.
Thanks, Larisa.
Very, very easy question to start off with.
No pressure. Thanks for having me. So I guess it wasn't all of a sudden for me. I mean, I guess the actual move is. But I had been coming and going to Armenia for many years, times more, times less. And then when, with evolving projects over time and my approach changing over time, the types of projects changing over time, the type of involvement, and then with COVID and then the war, I think with COVID I think a lot of people learned to use remote kind of Zoom meetings more. And we're like, wow, okay, we can do this much remotely. Mm-hmm. And, but then we hit another glass ceiling. And then it was so we were able to do more through Zoom, but then it hit something else. And I was like, now I'm not, whatever we're doing, it gets really exciting, it's really motivating, but I'm still hitting this block. And then with the war, I think like for most people, there was this intensification of wanting to do something. Mm-hmm. And around that time as well, I just started thinking more and more about my priorities and my options. Mm-hmm. And what are my priorities? And does how I spend my time align with what I think my priorities are? And I realized that they were not aligned. Mm-hmm. I started thinking about, okay, what could this look like? And was in the summer of 21, there was an opportunity kind of opened up or started to kind of fester in my mind. Yeah, exactly. And actually during COVID and when I was still in Boston, I found myself during these Zoom meetings, looking up apartments in Armenia. And we all do.
Were you multitasking?
No. But I found myself doing it more and more. Uh-huh. And then I found myself literally thinking, okay, well, this and that. And it wasn't just a small distraction anymore. It was a real thing. And then I realized, okay, I think if I can find this opportunity, then let's make it happen, and started to have that discussion with my family. Mm-hmm. So moved in February 2022.
So your move to Armenia, was it understood by your parents and by your family members, or was it
I think it was understood. Yeah. I think it was understood. So the approach was kind of, I'll try it for 2 years, kind of see how it goes. people ask me, is this a permanent move? And I think I'm old enough.
You don't think in those terms, I don't think.
Well, I don't think, I'm old enough to realize you don't know, right?
Yeah.
Like you think certain things in your life are permanent, but that's not how they happen. And so do I have the desire to stay? Yes. Is that my desired plan? Yes. But things happen in life.
Yeah.
So.
And you have a child who's almost 7.
That's right.
How is he liking it here?
I think he is liking it. He likes it more and more. He still misses Boston, but recently he said, well, when I'm in Boston, I miss here. And when I'm in here, I miss Boston. And I said, well, welcome to the reality, right? I think some years ago, I finally I don't know how, I don't remember when or how it was, but I accepted that I'm never going to be totally an American, whatever that is. I'm just not. And I'm never going to be a Hayastansi. I'm just not. I'm always going to be between two worlds. And once I accepted that that's my bridge. And I looked around like, who are my closest friends? There are people I have people from the States who are extremely close, and they are some of my closest friends, but they get me in that way. And I have people from Armenia who are extremely close, and they get me in that way. But the majority of my friends, and I wouldn't say they're closer than the other friends, but the majority of my friends, like you, bridge multiple worlds.
Yeah.
And I think maybe some of that is due to the fact that we have this diaspora and we've grown up in this way, and some of that is kind of borders or travel is more fluid now, right? But once I accepted that, I just became lighter.
Got it.
I just became like, it was like a weight was taken off, and I hadn't really realized that I had that weight. And so I'm like, that's how it is. So when my son said, well, when I'm here, I miss there, and I'm there, I miss here, I was like, yep, sounds about right.
It's I think it's called, there's a book called Third Culture Kids. I need to look back at the title, and I do not remember, unfortunately, the author, but essentially the whole book is about once you leave your home the first time and go somewhere else, even if it's in the same country sometimes, you just end up not fitting in ever again anywhere, because you've seen something else, you've sort of broadened your horizons, you've been in a different environment, culture, language, whatever that might be. And so you're never fully in the new place. And then when you do go back to your original home, you're never fully there either. So it was, growing up for me, I mean, I went from one country to the other. I changed a lot of schools. I had a lot of change happen in my life. And I was always really sad because I had friends who sort of went to kindergarten with, this one group of friends, and then they went to elementary and middle and high school, and they had prom together. And it was just like a constant sort of, variable for them or thing for them. Actually, constant and variable are opposite things. But anyway, right? But it was a constant thing for them. And I was sort of jealous of that because I felt like, why can't I have something like that? But then you sort of grow up to realize that actually you're probably better set up in life when you do have those experiences, when you do leave your comfort zone and, and so what? It's okay. I feel exactly the same way. I feel like every chance people get to criticize me, the way I show up differently is what's criticized. The language I have, I don't speak it perfectly, or, I have certain views that are perceived to be not Armenian, or, so but I think it makes us better ultimately. And I think it's a gift that we can give to our children too. We'll segue a little bit into why you're in Armenia, which is figuring out how to make our healthcare system better. Why are you in Armenia? Which country are you working for as an agent? But no, all jokes aside, you're doing really important work in Armenia, and I think you're tackling some of the most unglamorous parts of change in this country. And so would like to hear about what that is, what you're working on right now, and how it's been going.
Oh boy. I don't know if that's why I'm here,
Okay.
but it is what I do here. I'd like to contribute to improvement is how I would think about it. I work on a number of different projects. So I work, wow, it's really hard to know where to begin. So I guess I work with Co-op, the Children of Armenia Fund, on their health programs, and I focus mainly on a pilot program for primary care improvement, which is coordinated with the Ministry of Health and a number of other institutions in Armenia. I work with Henar on the pediatric residency program, or PrEP, which is a program to try to bring in kind of more improvements in residency programs, starting with pediatrics and bringing together a lot of the different institutions in pediatrics and trying to understand where we are and how we can shift to a different way of teaching our future pediatricians. What else do I work on?
Well, we're working together in Health for Armenia.
Yeah, we work together in Health for Armenia, which is trying to look, I don't know, you can summarize it probably better than I can, but again, it has to do with primary care improvement. So how do we take primary care doctors that we have and learning about how to help them learn and how to improve the teaching that they get and the learning that they get so that they can A, be leaders in the field, and B, and this is in no particular order, at least for a couple of years work in the regions and provide improved care. Because, and somebody listening will notice that this is all related to primary care.
Right.
And the reason this is important is because primary care, so for most people that'll be family medicine, pediatrics, general internal medicine, what some countries call a GP or general practitioner, is really the first line. And the vast majority of problems can be dealt with by a primary care provider. They're not just a gatekeeper. I think that's
how it's
an
perceived.
Understatement. That's how they're not just a paper pusher. They're not just a referral. They can actually solve the vast majority of the problems. And in many countries, so I am by training I'm both an internist and a pediatrician. So I have seen patients for over a decade. When I go, I don't see patients in Armenia. I don't think that that's very effective in terms of...
Except for me.
Except for you and the SMSs that I get from many people, which are great. I love them. But I do go back to the States and practice. I'm very lucky to be able to have set that up, at least for now. Hopefully I'm able to continue that. But I don't put in a lot of referrals. I don't need to do a ton of lab tests. I do them when they're needed, hopefully. But I don't need to refer them. I can deal with the vast majority of back pain, skin problems, lung problems, asthma, diabetes, hypertension, high cholesterol, COPD, and lots of other issues that come up. Don't need a subspecialist. But in Armenia and many other countries, primary care is just seen as the gatekeeper and they get referred out. So what primary care can do is not, by many people, not well understood in Armenia on many levels. And if you want to have a system that is cost effective and more importantly, actually effective in treating human beings, right? Whether it's a kid, an adult, a family, a community, a country, you have to have a strong primary care system. That's not just me saying it. I mean, the data's out there.
Yeah.
And so that's why I put the vast majority of my efforts into that type of work.
Got it. Why is it not landing with people? I mean, we've had decades of, right? I mean, there have been multiple programs, a lot of funding by international organizations too, to try to develop family medicine and primary care reform in Armenia. But ultimately, what do you think is the bottleneck? I mean, is it a distrust, just inherent distrust of the system? What is it? Is it a cultural thing? I mean, what do you think it is?
I mean, I think for I wasn't around. I mean, I have read about and vaguely remember personally the first time they tried to bring in family medicine around
that was
the
like
2000s.
2000s, yeah.
But I think, and some of it succeeded and some parts of it didn't. And there are different things that I've heard as to why not. And, if we did a root cause analysis, which I'm a big fan of, it would be really, really interesting.
Let's do it.
But I think one of the things is anytime you're trying to do any type of project, big or small, you need to think about all of the steps. and all the components. And what are the potential obstacles and what are our potential solutions and who are the stakeholders? And you need to have them together, meeting as a team, communicating freely, talking about what's working and what's not in an open and transparent way. And then trying to see, okay, did we get to our milestone? Why didn't we? Like, what can we do to fix that? And that includes not just educating the public about, okay, what is primary care, but things such as, do we have too many specialists? Do we have too many, back then we didn't have a lot of labs, but do we have a lot of labs or pharmacies? Are pharmacies or lobbyists going to get in our way in any way? Do our primary care providers have the knowledge that they need? Does our EMR, our electronic medical record system, have the capabilities it needs? Do we have the data so that we can track it? Do we understand what data systems we need? Do we even understand how to set the milestones and how to set objectives and track those over time so that we can know if we've succeeded and not just putting a check mark and saying, yep, we did a training. It's not enough just to do a training. You have to say, did the training get to our desired objectives? And then we need to track that over time and see, was that implemented, which we don't currently do in Armenia. And does the public understand why this is important? And if they don't, what is our plan to change that? But what I don't see having happened in the past is that all of those things have not come together. And I see that again and again now. So when I see projects put into place, and I'm far from perfect, but what I don't see happening is, hey, we're putting together a plan. We're going to try to change X. Who are our stakeholders? That I see. But then those stakeholders need to meet, right? In person and discuss and make sure they're all on the same page.
Right.
They know what the objectives are. Again, not just completing something, but knowing that they've succeeded. How do we know if we've succeeded? Right? They need to define the problem together. Let me take a step back. We need to define the problem together. We need to accept that there's a problem.
Yeah.
We need to accept that the status quo is not okay. And then we need to think about some of the challenges. So, hey, let's say we do a training for nurses, right? And let's say we do a post-test. And some of them don't pass it. And then we give them time, we do the training, we improve the training. And some of them still don't pass it. What happens to those nurses? Or what happens to those doctors? Are they allowed to continue? If you say yes, well, they've been working for so long, they need to have an income. I totally get it. In the rural areas, you all live in the same town or village.
And often the school or the clinic is the only employer, possible employment opportunity.
Right. Yeah. So how are you going to take away a job from that person, right? But let's accept that when we don't have a standard, then the undesired outcome is that people are not getting the healthcare that they need. Right. So either we need to have an alternative plan, right? Or we're going to say that, hey, even if you don't pass the test, you get to continue practicing.
Is it true that there isn't a licensing process in Armenia? I mean, I know for sure that psychologists and therapists actually don't have licenses that can be revoked for malpractice, which is concerning on multiple levels. And my hope is that there is that, at least for people who have malpractice.
There's no malpractice in Armenia.
There's no malpractice in Armenia.
Yeah. So it's a criminal case.
Stop this podcast.
It's a criminal thing. So
you need to file a lawsuit.
Right. So
okay. So I don't understand this.
So if I prescribe high-dose colchicine to somebody in the U.S., to somebody who has known renal failure or renal insufficiency and put them into renal failure or something, I do something that you shouldn't do, right? And I get sued. That's my malpractice, right? I have malpractice insurance. In Armenia, you don't have malpractice insurance. It's a criminal case. So you're putting doctors in a really difficult situation.
Okay. Wow. And then often, you need to have resources, right, to sort of file a criminal case against a doctor who you believe conducted malpractice.
I assume so, but I don't know the details. So
you'd probably have to, first of all, figure out who the lawyer is, hire the lawyer, pay the fees, go through a lengthy process. And, I would assume that most people would not have the resources to do something like that.
Before that, though, there's a cultural step. There are so many cases of mismanagement and poor management that I know of. But malpractice doesn't even cross people's minds, or suing, or any type of saying, hey, you didn't give me the best medical care. Doesn't even cross people's minds. I think that's a cultural thing.
So we're not asking for better care as people.
Yeah, so let me give you a case.
Yeah.
There was somebody I knew who was pregnant. She started to look really unwell from time to time. She would get pale, she would get dizzy, which is very, very likely a sign of anemia, right? And in many countries around the world, women are given prenatal vitamins. Now, you might debate, is it necessary or not? But at least you would check someone's hemoglobin, see if they're anemic. Do they need iron? So I asked her, so are you taking prenatal vitamins, or has your hemoglobin been checked? No, my OB told me not to take them. Okay. But like I see you frequently and you look unwell and you have like textbook signs of anemia and you're pregnant. She was like, well, I don't really like this OB, but she's a family friend, so I can't say anything. So over time, this continues, and I don't see her all the time, so checking in, et cetera, it didn't really happen too much. Not someone I know super, super well, right? Yeah. So I don't want to be intrusive. Anyway, it turns out that she got worse, ended up going, circumventing and going to a cardiologist who did an EKG, an echo, and a whole bunch of other stuff. And then the woman herself brought up, like, could it be anemia? And then the cardiologist said, oh, could you be anemic? So then the woman started taking iron, after which she started getting better.
And thankfully, nothing happened to the baby.
No, mom and baby are fine. They're great. But this is an educated person who has means. I don't know how much means. I don't know how much education,
but has
educated
access
person who has access. But wouldn't even stop going to somebody because of the context, even when she felt it wasn't, something was off. Let's go back to the licensing question.
Yeah, please. I mean, there's just so much to talk about here, because I think that this is what you're describing. I mean, I've personally seen a lot in the education sector where it's like personal relationships, emotional, whatever, baggage connection over reason, over data, over ultimately better outcomes for people. And, I've been living here for over a decade. And I think that this thing that you're talking about, although we're talking about this through the lens of healthcare, for example, or this one example of a pregnant woman who has anemia, can be sort of superimposed, it's showing up in different formats in every sector in Armenia, in every layer of our society, from how we operate schools and clinics to how we operate the country. And it's been the case forever. So anyway, we can go more into that or not, because we might need a whole new podcast session for that. But I do want to go back to the licensing question, because when I sort of learned that this is what's happening in Armenia, and we have the same issue with teachers. Like if a teacher does something that is against, normal conduct that actually is mandated in contracts and, et cetera, like what happens to people who mess up, like in a really big way. So I think, the messing up of educators, let's say, with their students is terrible and can have long-term psychological effects. But I think the messing up of a doctor could have an immediate life-threatening sort of consequence potentially. Right. So, if you can expand on that, it's super interesting.
So let me start with the fact that I know the ministry is working on changing this, which is great. This is something that they are aware of and want to change. And then let me describe what it is in the U.S. It's one country, right? It's one model. But let me tell you what it is in the U.S. So you get into med school, you take USMLE Step 1, you take USMLE Step 2. This is your medical licensing exams. The formats of those have changed a bit since back in my day, but they're still around. Then you take USMLE Step 3. And then when you finish residency, you take a national board exam. So I took the American Board of Pediatrics licensing exam, and then I took the American Board of Internal Medicine licensing exam. And then at the time, they lasted 10 years. So your license lasted 10 years, during which time you had to continue to take CME, which is high quality usually and standardized, or there are high criteria for it. So it used to be every 10 years you sat for your exam. That's actually changed, and there are different, you can still do that actually for both of them. But the exams now, I can actually take, I think in pediatrics, it's something like 16 questions every 3 months. And in medicine, it's more than that. It's like 20 or 30 or something. They just switched it for me. So, because we're on cycles. So now every 3 months, I sit and I take questions. It's open book.
Interesting.
But I have a time limit for each question. So it's not, have I memorized something? But
can you locate the information?
Do I know how to find it if I don't know the answer?
Yeah. Every 3 months?
Yeah, I can take it every 10 years, but I don't like sitting down and taking tests. They stress me out.
I
do it
see.
I take it every 3 months.
Got it. Okay.
But that is only one component of my license. There's also the CME. I have to do a certain number of CME, and I have to do a quality. This is newer. We didn't have this like 10 years ago. I have to do a quality project, and I have to show data. So the most recent one I submit, luckily I can use my CME for both. So I don't have to do double the amount, and I don't have to do 2 projects. They just want to know, am I working on improving something in my sphere? And do I understand data? Do I understand how to collect data? So that's what the US standard is currently, multiple components, and then some big fee, which is outrageous. But I get it. They have administration costs in case ABP and ABIM are listening. In Armenia, there isn't the equivalent of USMLE 1, 2, or 3. There are exams during medical school. There are exams during residency, but they're not standard. And there's no board exam. So currently, to maintain your license as a physician, you take a certain number of CME.
Okay.
And I think more recently, and don't quote me on this, if you have not been, in order to maintain the license, you have to be practicing X number of years out of the past Y number of years and have CME. And if you don't, then you might take an exam or something like that. But I'm not exactly sure about that last one. But there isn't an exam that everybody has to take with a standard. And if you don't pass it, there's a problem. There's no QI project, quality improvement project. There is CME. So it's very different.
So in medical school in Armenia, are students taught to think with data or no? Like, do they have to collect data? Do they have to do research? Do they have to do like comparative, I don't know, analysis, whatever?
So my experience from talking to medical students over the years and working with residents, and not just the residents we have now, is that there is great, as we would say, great room for improvement in how they look at data and how they think about medical data, health data, or even just a case, like thinking critically about a case, or what we would call clinical decision making. Mm-hmm. So I've seen a broad range of skills in medical students, residents, and actually acting physicians, or attending physicians, sorry. So there's a very broad range, but what I've seen would lead me to believe that the foundation isn't there.
Got it. And in your experience, or like what you've seen, are we going back to this original thing that we discussed, which is like understanding the actual problem that we have in Armenia in the healthcare system, for example? Do you feel like people are beginning to understand what the system gaps are, or like where we need to focus on the most or invest the most resources into, or have the data to support? Like, first of all, I still don't understand if we have mechanisms in place to see, you know, what your health outcomes are if, for example, you live in a village that's far from Yerevan or far from a city that has, you know, a bigger hospital, for example. You know, I think we're starting to compile a lot of that for education. I don't know if we have something similar for healthcare. I think it's less. but please correct me if I'm wrong. And then, are we trying to understand like what the public sector healthcare system is? Because often I feel like we're very focused on the capital. We're very focused on private hospitals. We're constantly creating new clinics. In my understanding, there isn't oversight and there isn't a demand to, meet certain standards. And because there isn't a license or there isn't like a certain national framework that these clinics can follow. And so it just seems really unregulated, like most sectors, I think, are currently, unfortunately, in Armenia. And so I guess what I'm trying to say are our universities or is our Ministry of Health like really actually trying to figure out the healthcare public sector sort of challenge versus like focusing on just like fixing like technical things here and there? Like, do we understand like the magnitude of the crisis that the healthcare system is in?
The answer to all of them is yes and no. What I would say is I think we are starting to go in a direction where we look at health outcomes, but we are not there yet, and we haven't been for a long time. And I think to me the most, let me give you a really just basic example. So diabetes and cardiovascular disease, diabetes, hypertension, things that are related to that, stroke, heart attack, kidney disease, these are very, very common in Armenia, right? And cardiovascular disease is the main driver of or cause of premature death in Armenia. Not surprising, right? We don't eat well, we smoke a lot, we have a lot of stress. So not surprising. A lot of people don't exercise or their lives don't have a lot of physical activity, especially nowadays, which is an international problem. It's not just Armenia. This is around the world, right? So I'm not trying to single out Armenia in any way. So let's take diabetes. So the best thing to do, first of all, is actually prevent it, right? If you can create this utopia where there's less stress, people eat better, food is healthier, et cetera, there's less smoking, then you don't develop the diabetes in the first place, including all the kind of social determinants of health and that whole context. But let's say we don't have that. We have what we have. So let's put that aside for a minute. So then we have a lot of people who have diabetes. First, we have to diagnose them, which means we have to have the resources and the knowledge and the skills to diagnose them. And we have to have the skills to diagnose people who don't want to be diagnosed, right? Mm-hmm. It's a stigma in Armenia, just like it is in many countries, to have some type of chronic illness, or the concept that you need to change your lifestyle and or take a medication to control this disease or manage this disease. So in Armenia, so once you've diagnosed it, you need to manage it, and you need to manage the condition itself properly, right? So you need to know, how often do I do this test? What dose medication do I give? How do I talk to the patient about it? How often do I follow up? All of those things. What other things do I have to manage along with the diabetes, their smoking, their cholesterol, their hypertension, all of that. And again, just to reinforce, what are the other factors that I can help with, right? Because you can actually make a significant difference with just getting people to dance at home. So that's a whole nother topic though. So then you have to be able to do that. And a primary care doc can do that, right? One of the huge advantages that we have in Armenia and in our healthcare system is that every village has a health post, even the smallest village. So you have an ambulatory clinic with family medicine doctors in the larger village, and then you have smaller health posts with nurses. And our docs, they know our patients. They know their patients. They know who has what, when, who was related to who. It's amazing. And it's actually a really wonderful thing to see, right? Because they know them. That's an advantage.
I think that's the other side of the coin of like, oh, I continue to go to my OBGYN because she's a family friend. But the other side of that is like also because we have this sort of, I don't know, it's a cultural thing. It's an approach to people in general. I think it also can work to our advantage sometimes.
Yeah, exactly. I totally agree. And but we have had for over a decade relatively accurate guidelines on how to manage diabetes. with the tests that you need to have and how to manage them. But it's rarely actually implemented. And if you talk to people who have diabetes in rural areas and you say, hey, when was the last time you had a hemoglobin A1C? And you kind of explain the test, they're like, what is that? Or, hey, I think I had one 10 years ago.
But why? Go ahead.
Our national quality measures, which are being changed, have diagnosis, screening of diabetes, screening for diabetes, right? So I'm in a town, I'm a village, I'm in a polyclinic in Yerevan, I'm a doctor. I screen my patients with the right subpopulation for diabetes. None of those measures are outcome measures. They're not even process measures. So in the US, for example, in our clinic and in many clinics I've worked in, we don't even look at this, we screen, but our measures are actually, did I do at least 2 hemoglobin A1Cs in a year? Did I work with a patient to help them control their diabetes, right? Is their A1C less than 7 or 8 or 9? Right? We want it less than a certain number. And I have data around that. Here are the patients attributed to me. Here are the ones who have diabetes, and here are the ones whose A1Cs are less than 8. So, Lorky, 80% of your patients have an A1C who have diabetes have an A1C greater than 8. Great job. Okay. Or, Lorky, only 20% of your patients have an A1C less than 8. What's going on? Let's think about it. Let's look at the data. Right? This is very standard in the US. You see it. We can pull our list. We can try to understand.
And talk about outreach. Yeah.
In Armenia, none of the national quality measures are process or outcome based. There's no A1C test being done, and it's not in the quality measure, much less whether or not the A1C is controlled. It's just, did you screen them? So screen them, by the way, you're diagnosed. I'm not saying the doctors aren't managing them, but if it's not something that if a doctor is being given a bonus for their behavior because you want to promote that behavior, and the only thing you're giving a bonus on is the screening, but not doing the A1C or having a controlled A1C, the message you're sending is all you need to do is screen.
Not achieve any certain results.
Now, there may be many reasons for that. Maybe there's a recognition, conscious or not, that we're not doing A1Cs and the state maybe up until recently wasn't willing to pay for them or thought that they could. Whatever it is, what we have done to date is reinforce just the screening, but not the management.
Yeah. I mean,
I don't know if that answered the question.
That answers my question in many ways.
But that's changing.
It is changing, yeah, definitely. I mean, we've seen that at the Ministry of Education too. Before, when I was starting TFA, I was trying to figure out the problem, what is our theory of problem in Armenia with the public education sector. And there were a lot of data sets, I don't know, different international organizations were recording data, but because there wasn't a sort of a hypothesis of let's try and see what this data is actually showing us. Let's try and see how outcomes differ for kids, academically, if they're here or there, or their parents make a lot of money or not a lot of money, or they are close to the capital or not close to the capital. We're not in that thought process. And therefore you have all these data sets, but they don't mean anything. It's almost like a checklist. Okay, yes, we know how many kids are in this school and that's it. And then we don't really know what that all means or what to do with that. So, and then when there are changes being introduced, often they seem to be more technical. There's this interesting diagram that I constantly think about where how does actual ultimate system reform happen? And it's sort of like a line that sort of shows what the easiest solution is versus what the hardest solution is for system change. And at the lowest level, it is technical solutions like changing a textbook or, I don't know, creating a new checklist for screening or, et cetera. But if you stay at that level, change actually never happens. The harder thing to do is actually work with mindsets and develop leadership and get people to talk to each other and to analyze and to reflect and then be in this circle of learning together. And that's why I'm so excited and a little plug-in for our work about Health for Armenia, because ultimately what what these kinds of programs do is actually develop leadership within people so that they can do the harder part of that diagram. And then, yes, improve the technical aspect and all these other aspects that are absolutely really important to think about and to change. But if you don't have that human resource that's working well together and is able to like analyze and, you know, be in this learning process together, then I think any technical solution will improve things, but not in a transformational way.
And I think that's key, is that people need to come together in a group and be able to wonder and ask why and be transparent together.
Yeah.
And I've been in way too many meetings where what is being discussed clearly or what is being said clearly is, or at least to me was very clear, I was like, what is being said right now? Like, this is not what's happening. And if I speak up, I get into a tiff with somebody, nobody else says anything. And then later I ask a couple of people, was I wrong? And they're like, no, you're absolutely right. I can give you 5 more examples, but nobody says anything.
Why?
I mean, my guess is because it's a cultural thing, right? Mm-hmm. You don't speak up.
Mm. Where does that come from?
Don't ask me leading. I think it's both. I assume it's both an Armenian hierarchy thing and a Soviet hierarchy thing, right? I mean, I've been in hierarchical situations in the U.S. And had to kind of temper how I say things. So it's not like it's just in Armenia, but there are some really good people who have really good information and institutional knowledge here who can't speak up in a meeting. And I wish they said what they knew. But I also can't blame them because this is the system, right? That has to be top down. You have to be able to say, it is okay to say something different than what somebody who's higher up than you is saying. And we don't have that culture. We don't, I can do it because I'm not from here, right? Which almost makes me wonder if I have a responsibility to do it, to call it out, which is very debatable and is, a difficult idea, I think, because we could talk about that, right? That's kind of self-aggrandizing to say that I have some responsibility to do that, but it's easier for me to do it.
Yeah.
And there are ways
it's
of
almost like you
change.
have less at stake.
I definitely have less at stake. Mm-hmm. I have more practice opening my mouth. But I think also it's for some people, I have less at stake. And I think people do speak up, but in ways that maybe I don't get the nuance, or they're behind closed doors and they happen differently. Mm-hmm. So I've wondered a lot, this is going off a little bit on a tangent, but I've wondered a lot about what my approach is and the way my training has been in terms of quality improvement, and how it's so different from here. And I keep going back to maybe I'm just being somebody who came from outside, and I think that my way is right and this way is wrong, right? And I keep trying to break down my assumptions, my framework. There are other ways of doing things. There isn't only one way. My way is not the right way. So I keep trying to figure it out. And I'm saying, okay, what's most important? What's most important is that we see change. So I say, okay, I know that if I do it my way, there can be change because we've done it. I've done it before, right? In a different context. Is the way here producing change? That's the question I keep asking myself. Is the way that I see, not in everybody, but in many people, producing change? And then I wait a month, and I wait 2 months, and I wait 3 months, and 4 months. And there's no change.
Yeah.
So to me, I'll accept any way, and I'll learn it, and I'll be a part of it if I see that it's effective. Mm-hmm. But in many times, not all the time, but in many situations, I'm not seeing the effect. And that's, I think, it actually gets me down sometimes, is how do I bridge those two? There are 2 different frameworks, and I can't impose mine. It doesn't work. But the one here, oftentimes, not always, but oftentimes, is not producing an effect. Mm-hmm. Anyway, I went off on a tangent.
No, it's not a tangent at all. It's such an important point you're making, and something that I've personally been thinking so much about and have centered all of my work over the last decade thinking about how do you develop local leadership in Armenia, not at the top level even, like not only at the ministry level, not only at the regional government level, but how do you really see each person as someone who can enable innovation and change within their own domain, scope, whatever, however big or small that might be. I think we've just been raised, and I'm a byproduct of the Soviet educational system too, to not think in that way. I mean, it's, it's just, something that was not developed. But when I work with our people, and not necessarily like just the youth, it's like we have 50-year-olds and 60-year-olds, for example, who are part of Teach for Armenia, who have so much knowledge and experience and just need the right kind of coaching and mentorship and support, not just a one-off session or training for a check mark, but an actual method and approach that enables them to have courage to ask questions, to do things differently, to experiment, and to
make mistakes.
Most importantly. And when you work with people in that way, these very same people who maybe used to have not the best outcomes with kids in their classrooms, in my experience, all of a sudden, the data is different just within a few years. Like that same person who was unhappy in their position, doing things not in a very great way, is all of a sudden not just happier and their students are more engaged, but statistically speaking, these kids are learning better and they're having better outcomes in their academics. So I ultimately believe that whatever, happens in Armenia, I think at the core of it, at the core of any sort of real reform or transformation will be the leadership development of our people and the belief that these people, we the people, can affect change. And we, don't have to have it come to us from the national government, for example. Sometimes I look at the way our schools operate and our national curriculum, and you would think that our schools are so restricted and constrained, and they're so mechanical almost in so many ways, and so just stiff. But then you look at the national curriculum and you read the law, and nowhere does it say that teachers can't experiment and innovate with new approaches and new methods. So then the question is, well, if it's not illegal to be innovative, then why are people not trying? And why are they not experimenting? And when I started this work, I would often feel like one of our biggest challenges were just the narratives and the mindsets that we've created for ourselves, this box that we've put ourselves in, when very often that box actually doesn't have to exist because it's possible to do things differently. So, I think in our work also, and I know you've been sort of working in this direction, but just like how can we create these bright spots across the country? They can just be
islands of sanity in a sea of chaos.
Exactly. And driven by data, where, brilliant, smart, committed people who care about this country can just try things differently to see if there's a better outcome. And quite often, not always, yes, there is.
Yeah.
And so then how can we take that and feed that up to our policymakers and the people who, are in a position of power and scale that kind of learning? That's what really excites me about Armenia's future. Is I think ultimately I've grown to learn that there are these people and we just have to find them and we have to work together and we have to cultivate each other to envision like a completely different reality.
On the same line, so there's a kind of youngish professional, early mid-career professional here who I've known now for a couple of years and worked with this person on and off. And this person is involved in a project, and this person is very interested in change and how to do things differently, and just really thinks differently, and gets into trouble because of the opening of the mouth. And so now is very cautious. But is involved in a project that has people who don't think, who aren't innovative, who are more like, this is how we've done it and this is how we do it. And this person called me and said, this is what's happening. I want to do it this way. I remember you and I talked about these other ways of doing it. But when I'm suggesting it, it's getting blocked. Mm. And I was simultaneously so happy that this person called me for like advice or support, or even just to vent or to brainstorm ideas. And simultaneously was so sad that this was happening, right? But I see these people like this person and others who, if we can support them, because they want to do it, they're already internally motivated, they want the change. So if I can somehow help one person be a sounding board, be a brainstorming idea, be a venting board, is that even a word? For somebody
venting
like
board,
that.
I like it.
Venting board, right?
Venting board.
Venting board. For somebody like that, I think that's a great role.
Yeah.
It's not, why am I here? Am I here to come and change the system? No, I can't come change the system. But I can support the people who understand the system better than I do, because they're in the system, but they themselves want change. And they're going to be able to adapt it better than I ever could. As much as I might go and talk to people in a town, in a village, in a city, residents, kids, adults, I go and like run a patient experience of care sheet by 5 guys smoking in a village, right? And say, hey, what do you think? It's like a mini informal focus group. I'm not going to have the same mindset. I'm not going to be able to, I can adapt things as much as I can, but somebody from here who says, I like this, and this about what Lorky said, or about what Larisa said, or about the system they're bringing, right? Or the frameworks that they're presenting, and we should bring that. Being a sounding board for that person is, I think, one of the best roles.
Mm-hmm, mm-hmm. And as you said, like helping them connect with others who think in this way, so that they don't feel alone. I really wanted to mention that. I recently learned, and we're sort of going back to the earlier part of our conversation. I recently learned that Armenia has one of the highest out-of-pocket expenses for healthcare.
That's right.
In the world.
That's right. A couple of years ago, it was the highest, I think, and the graph has come down a little bit, but it's kind of moot, right?
I mean, that's crazy.
Yeah, that's crazy.
Okay.
Yeah. Okay. No, it's absolutely crazy.
Next question.
Because also, it's not like we're doing out-of-pocket and we have better outcomes. We're not actually changing the outcome. I can go pay for 2 MRIs and see 5 doctors and get a really high out of pocket. Is that even related to a better outcome? No. It's not. Even then it would be crazy, but now it's like double crazy, right? It's crazy squared because it's highest out of pocket and not great outcomes, like poor outcomes, and lots of unnecessary care and intervention. We don't intervene as a system. We don't promote. When I say we don't intervene as a system, we don't create the systems. We don't create the data systems. We don't create the educational system. The public health, public educational system, and for providers and clinical teams to provide the care that we do need to provide. And we do facilitate as a system a pharmacy and a lab on every corner, right? We don't need these many tests.
Yeah, we have a mutual friend, Dr. Shant Shahardimian, who's also talked a lot about this, that there are, for example, way too many hospitals in Armenia, right?
There are way too many hospitals.
Way too many hospitals.
And I'm so tired of hearing about another clinic that's going to open, more beds that are going to be created. We don't need more beds. We don't need more clinics. In fact, we need fewer of them, and we need them to work better and actually provide the care. The diaspora has a large role in this.
Thank you for helping me segue into the next part of our conversation. Yeah.
You can put your gold plaque on a room, on a building. You can get your name in the paper for that. But you don't get it because you actually got people to start doing A1Cs. Or because you said, hey, let's TPA people if they have a stroke, or let's stent people if they have a heart attack. It's sexy. Great. I'm going to need stents. I mean, we have heart disease in my family, so I'm going to need cardiac stents. Big fan. But before I get to that point, or before our population gets to that point, we need to be checking their lipids. We need to be doing lifestyle management. We need to have public policy that is implemented and maintained, right, to prevent cardiovascular disease. And then we need to be able to provide the medications if it gets to the point that somebody needs them. Because I'm by no means a drug pusher, we need to provide those medications. I shouldn't be able to go under the Maastricht's underpass and see, you know, a 6-year-old smoking in the mirror and looking at himself in the mirror, or holding an unlit cigarette and looking at how great it is. And, you know, whatever that is, the store there with all the smokeless tobacco, right, out in the open. Like, I shouldn't be able to go and see police smoking right outside the cafe at the seats. We shouldn't be able, because it's technically illegal. I was in the Ministry of Health last year. I'm walking down the spiral thing in that building, and I was like, there are 2 guys in front of me, and I was like, is that dude smoking? Is he literally? I was like, there's no way. So I'm watching him, and the guy is smoking, and he walks past the guards in the little circle area, and the guy is smoking.
And nothing.
Nothing. So I catch up with him.
Uh-oh. I'd run if I was him.
And I was like, you know, there's no smoking in the building. And he's like, he goes, in what building? I go, in any building. He's playing
in this
dumb.
building,
I'm
yeah.
like, in any building. There's no smoking. He's like, oh, really? I was like, yeah. And I go, you shouldn't be smoking in this building. And he's like, lave mare. Like, I did the right thing. Like, I did a good thing.
Maybe he was flirting with you.
Yeah. I don't think so. And so then I was like, really? And he goes, yeah. How on earth? Like, what is the point of having, and I know it's really hard to implement, but right, and then maintain it. But given how damaging we know smoking is, not just to the smoker, but everybody around them, we have to make sure that we're implementing things. It's like if your kid is doing something they shouldn't be doing, and you go, don't do it, don't do it, don't do it. When you say don't do it 10 times and nothing happens, don't do it doesn't mean anything anymore. It has no value as a set of sounds and consonants and vowels and syllables. It doesn't mean anything. When you have a law that doesn't mean anything, it means that your other laws might not mean anything either. So I think it's the smoking is a huge, commendable step. I mean, I know a ton of work went into it.
I'm shocked that it even worked.
It's amazing. I mean, it's brilliant.
Yeah, when that law came out, I was not against it, but I thought that it should have been rolled out phase by phase. Like, the first phase, you actually make it illegal to smoke inside. And then outside is still okay. And then ultimately, like a few years later, maybe like the outside also is off limits. But they just sort of went with it. And overall, like, it's working, it seems like.
And not in a lot of the cafes or in other restaurants that will go unnamed. But we also don't report people, right? We don't tell people because amota, it's a shame. You don't do that. But it makes me sad because it is a huge step in the right direction. And the fact that it's not implemented the way it should be, and I know there are a million challenges and resource issues around it, but it makes me sad because it really is a really important step and a really important law.
Mm-hmm. Lorky, another thing that I know you and I have talked a lot about is women's health. And, we both work a lot in the regions, and I think there's a lot of unsaid, kind of going back to just like the common theme, it seems like, of our conversation, just like the unsaid truths of what's happening to women and their health and their sexual and reproductive health. And I'd love to just hear your thoughts on that. And then also, I read another statistic that we have one of the highest rates of maternal death, right? In Europe, I'm not sure.
I'm actually not sure about that.
Yeah, it was a World bank report, I guess, I think, and it was published a few months ago, and I can pull it up, but basically it was a pretty high rate of maternal death. So that was kind of scary.
Yeah,
So
it's scary.
What's going on there?
I don't know. I'm not going to speak to them. I mean, I've seen the numbers. The data shows that they're coming down, I think, over the years. But I don't want to speak to that because I have not done a deep dive into that. I think in terms of women's health, there are advocates out there who talk about it, which is extremely important, whether it's domestic violence or inequality or women's rights. But even docs don't see themselves primary care docs often don't see themselves as broaching that topic. And we don't set it up as a comfortable way in a clinic, for example, for a woman to talk about a female issue that she's having. Even just some of the most basic stuff, you have to go to a gynecologist, which is totally unnecessary, absolutely unnecessary. So we have a lot of shame, right? We don't talk about certain things. And the men as well. There was a woman who came to me and said that her husband was having kind of urological problems, but they won't bring it up to anybody. So I will say that there's actually a similar issue with at least some component of the issue with men as well. And there isn't access to somebody who can talk about it. And as most of the primary care providers are women, they're much less likely to talk about it with a woman. But going back to the women's situation, I think whether we're talking about just routine gynecological issues where because a lot of the primary care providers don't feel empowered or don't feel that it's in their scope or feel uncomfortable talking about it, women don't often in remote areas have access to care. And then if we think about breast cancer, right, as one of the top cancers in Armenia and a really high rate compared to other places.
Which is also one of the most treatable cancers, right, if you have preventative care.
If you do screening, there are a lot of options for treatment. Now, whether or not that treatment is accessible for you as a woman in Armenia, whether the top, like the most frontline or first line medications are available is another issue, right? But the understanding around why we do screening, what that means, treatment, that it is treatable in many cases, we don't have that there. It was very interesting, and this is a little bit of a side tangent, but I did this. I went to a bunch of villages in a region and had this conversation about what do you think health is? What do you think quality of healthcare is? What does that mean to you, right? And so in this one small village, there were a group of women sitting around, and we were talking about health. And I said, well, what about the mobile van that comes around, or getting mammograms? And they're like, well, I got that letter, but I didn't even open it. The letter there was an invitation for a free screening mammogram. I didn't open it. I was like, okay, I'm just listening. We're discussing. And one of the women keeps talking about this abdominal pain she's had for years and all these tests she's done, which clearly would have topped 100, if not 200,000 dirhams. So
that's a lot of money.
300, 400 probably over the years more. And she keeps going back to that, like how her medical problem hasn't been solved despite all these tests that she's done. I said, okay. Really unfortunate. We're talking in the group, and a lot of the women are saying similar things, but especially this one woman on the right. And then I said, breast cancer is like a really leading top cancer, very common in Armenia. Gave some numbers, and I was like, but it's in many cases treatable, especially if you catch it early, which is the whole point of screening, right? So we talked about screening without symptoms, et cetera. And then they kept saying, that letter I got, I didn't even open it. And I'm like, oh. So we're talking. And then at the end I go, so I just want to reflect back, right? Something we don't do often in Armenia, that reflection, whether it's reflecting to others or self-reflection. I said, so you've spent really this large amount of what sounds like a large amount of money, which most people don't have, on trying to diagnose this abdominal pain that you've had for years and haven't really gotten anywhere. She's like, right. I go, but this free mammogram that would help you catch something early, you didn't open the envelope. Like you knew what it was, but you didn't read it, or you didn't open the envelope. She goes, yeah. And then I saw these light bulbs go off. And all of a sudden the woman across from me goes, next time I'm going.
Okay.
next time I'm going. But I think those are the level of conversations that we need to be having about some of these things. And we're not having them. But that for me is like a huge learning opportunity, right? And I'm constantly breaking my assumptions about how do we communicate to get somewhere and what does that take? But it takes time and it takes a certain type of conversation. And I'm sure somebody from here would have had that conversation much better than I would have had. But it was, an hour-long conversation until we got there. And that wasn't even my intention starting out, just talking about things. But in terms of going back to your question about women's health, I really, at least in Yerevan, you can find good women's health. It exists. It's difficult, and you have to be asking the right people who then, refer you, and it's expensive, but it exists at least. Although really poor care also exists in Yerevan, right? And there are practices that are probably really, that are definitely unethical and definitely not evidence-based. But in the rural areas, it's even worse. The stories I've heard about giving birth in Armenia, that a woman who had, a friend of mine was telling me that when she was delivering, a woman next to her was in a lot of pain, vomited, and the nurses made her get up and clean up her own vomit while she was in labor. Like, how is it that if one of our priorities in this country is children, women, families, and a larger population, that is even close to acceptable? How can that possibly be?
Where does that come from? I've seen it. I've seen it for myself. I haven't given birth in Armenia. I was stuck in, anyway, it was the pandemic and I was stuck in a different country and had to give birth there. But I've seen it. I've seen the treatment. Like, I was in a big and famous hospital in Armenia recently in Yerevan, and I was in the maternal ward and just, meeting with my doctor, and it was just really scary.
If we want women to have more kids, they need to be queens. They need to be treated like queens from the beginning to the end, right?
The way the women were being talked to was
abysmal.
It was abysmal. It was like, you don't even, I don't know, like, they say you wouldn't even talk to an animal like that, but I think animals deserve a lot of respect too. So I don't know. You just don't talk like that to anyone, any creature, especially human beings. And it's just, and I wonder where that comes from, because it's also like maybe the third side of that coin. Is it? I don't know. Like, we can be so warm and familial and supportive of one another, and then all of a sudden, like, you have this, other side, and it just doesn't seem familiar to me in a way too.
I sometimes I wonder if it has to do with control, right? Doctors tend to be demeaning, and this is true, has been true in the US, although it has improved a lot, I think, to nurses, right? There's this hierarchy, and nurses to the cleaners and whatever. So whoever seems vulnerable is who you can exert control over, right? Because somebody is exerting control over you, and maybe not in a very nice way, so you exert it over whoever you can. I was recently in one of the hospitals here teaching a seminar, and we were in a room, and I was with two residents, and the cleaning lady came and started yelling at us for no reason. First, she started yelling at the residents, who were clearly younger. There was something about whether or not the window was open or closed, but it had nothing to do with us. Like, I don't even remember what it was, or something being in the trash can. So I kind of watched for a while, and I was like, okay, so she's kind of being really rude and mean and just kind of yelling at these residents. So then I went over there, because I'm obviously older than they are, and thought maybe, and I'm not from here, so maybe that will make, I don't know, let's do this social experiment, right? And I was like, that's not, and they said the same thing. The residents were being super kind and nice, and we're like, that was like that before we came in, or we haven't touched that, or we just came in, it's not related to us. We have the right to be in this room, it's been reserved, whatever. She just kept going. And finally, with this huge smile, I was like, you're talking to the wrong people. We can't solve your problem. We didn't cause your problem, and we can't solve it. So you can keep yelling at us, I said with a really big smile, but it's not going to change anything. And she just kind of took a step back. I mean, I could have just exerted control and like yelled at her and imposed some type of hierarchy, which may or may not work. But I was like, let's try a different approach. And then she stopped, but I wonder if the same thing happens with nurses and doctors, especially when a woman is that vulnerable. She's in pain. She can't fight back. She's in a very vulnerable, that chair is like, doesn't get much more vulnerable than a gynecological table, right? Or a delivery table. And so you can just impose.
And also if you're a paying patient or you're not a paying patient, and like, did you get the shared room or did you get a VIP room, or like a whatever premium room? And the experience and the way your experience differs based on your income is like, there's no better way to see the inequities that this country has due to income, rather than more than spending a few hours in a maternal ward, even in one of the best hospitals in Armenia.
So let's say our goal is to increase the number of children people have, right? Mm-hmm. I think one of the exercises, and maybe it's been done because I'm not in maternal stuff. I'm the pediatrician. The OB catches the baby, gives it to me, and I can do stuff with the baby. I can resuscitate the baby, or I could, right? But the coming out part is not what I do. But if we're trying to increase fertility rates, you got to think about all the things you need to do that, right? And you got to think outside the box. And you got to ask why, right? Like, aside from, obviously there's the 5 whys improvement methodology, but we did that as kids, right? We always asked why? Why is this
my kid is in that phase right now.
Why? It's a great phase, but we stop ourselves from being in that phase for some reason, and we become boring adults. And then we'd be like, okay, well, let's make it, what are some of the reasons that women don't want to give birth? Right? And what can we do? And maybe it's not because they're scared of delivery, although I think some women are scared of delivery, right? But also, what can we do to promote it and make it a better experience? And that should be part of the plan. So that means any government official who walks into a maternity ward and sees what's going on, not for the VIPs, but for the proletariat, for the regular people on the street, right, should say this is against what this country stands for, or what this country needs.
This is against,
This is not allowed. Done.
This is not okay. Supporting our plan,
right,
of getting more women to have more children.
And when we don't do that, then we're saying it's okay. When we don't speak out against something that we know is against what is supposedly a priority or a strategy, then we say it's okay. So anyway, sorry.
I wish we had more hours, because another thing that's really been on my mind is taking care of newborns and how that's conducted in Armenia. My heart stops when I see all these little tiny babies who are, newborns, and they're in these cribs that have a ton of pillows in them, and they're being wrapped in like multiple blankets, and they're overheating. And it's just so dangerous because SIDS and all these other problems, and just, if I could develop a new program, maybe for the Ministry of Health, I think I would have a little baby box. Like in Scandinavia, they have this really great program where when a woman gives birth, they provide this like box that ultimately ends up being a crib, and it's like the safest place a baby can sleep in the first 5-6 months of their lives, with like formula and diapers and all these other things that.
Can we remove the formula?
Okay. Yes. Okay. You don't like formula.
I'm not a fan of formula.
You're not a fan. Okay.
I mean, in some cases you need it.
Yeah. But
breast is best.
Breast is best.
Breast is best.
I say fed is best.
Fed is best.
Yeah.
But breast is best if you have an option.
True.
For sure. I don't think
that's also kind of, sorry, going back to what you were saying, I don't think women are supported correctly with breastfeeding. It's such a traumatic experience for so many women. It was for me. And I had access to like some of the best healthcare. And I ended up not being able to, because I don't think I had the right kind of support. And ultimately I ended up pumping for like 6 months and feeding my baby my own milk, but through a bottle, which I still consider to be breastfeeding.
Totally.
But yeah.
I mean, I had a close friend delivered a couple of weeks after I did. And she they pressured her to breastfeed, and she wanted to breastfeed. She wanted to breastfeed so much. This is in the States. And she wanted to breastfeed, but she felt like she didn't have enough milk. But she kept trying and trying. Lactation consultant came. This is like a big hospital in Boston, right? To the point where she was like, she cried. She told me she was crying. It's great to encourage moms to breastfeed, but not to the point where you're making them cry. I was like, what on earth?
Yeah, we've suffered enough, I think.
Yeah, so she ended up formula feeding, which is absolutely fine. Fed is best, but she wanted to. I mean, so that you have to have programs in place to encourage breastfeeding, to make it comfortable, to make it socially acceptable. But you don't do it to the point of making a mom cry.
Can you reflect some of these ideas in the pediatric program you're building, please? Okay, cool. Lorky, I know, like, you know, when we sit down and we talk about these things, it just sort of seems like ultimately, I don't think we're able to really reflect how hard this work is. Like, yes, we can talk about it. It all sounds interesting and like challenging in an intellectual way and fun and gives our lives a lot of purpose. But, you know, I know how hard it is too. And I know how hard it's been to be in some of these conversations and push a lot of this work forward. How do you navigate that? And how do you sort of build up your energy tank and not ultimately burn out? Because, you know, anyone who's looking for a burnout can come to Armenia and work on improving any sort of sector or system.
It's a really good question. So there are definitely times, I was actually just writing a friend this, most of the time I'm like, there are challenges, I intellectualize it. There are challenges I'm learning, I'm growing as a human being, right? Because I'm constantly reflecting on my mistakes and what I should do differently. And getting feedback from people around me. But there are some days, there'll be like 2-3 days in a row where I'm like, holy.
And then you write to me and it's like, let's go have a bottle of alcohol.
Yes, sometimes. I mean, I think, so self-care is important. I would be absolutely lying if I said I engage in self-care. For me, self-care would be like, certain forms of exercise, lifting weights, whatever. And I haven't done that in a really long time. I think what gets me out of that funk sometimes, what I've noticed is that there'll be something small, like the smallest thing makes me happy. Like I'll be in this like funk, like I'm not getting anywhere. I obviously don't know what I'm doing. Obviously I have to rethink my approach. This is overwhelming, or I have too much to do, or I'm not communicating. Like I miss having a team, which is a big thing recently on my mind is that team, because having people around you is key, right? And I was in Lori like a couple of weeks ago, and I was kind of like getting into this funk. And I looked down and I saw this like little butterfly just sitting on a stone. And it just made me so happy.
Aww.
And then there was like a little ant crawling next to it. And I just forgot everything else. And that's all I wanted to think about was like that beauty, like that reality. Now, it doesn't like fix all the problems.
Yeah, but it grounds you.
It grounds me. It totally grounds me. And sometimes I take pictures of them, and I'm not a photographer, but I like taking pictures of things like that. But sometimes part of it is just the beauty of it. And part of it is remembering, like, to me, one of the most beautiful things is that we get so caught up in ourselves, our system, our country, our earth, our world. But really, like, we kind of don't matter. Which it's the opposite side of the coin, as you would put it, right? Like we get fully into it and, oh my God, I have this list of like 50,000 things I have to do and I feel overwhelmed and I feel like I'm not getting where. And then the opposite side of that is of that coin is we actually don't matter. Like on this earth, we are one species, a pretty destructive species, kind of pretty terrible, destructive, dumb species sometimes. And I include myself in that.
Same.
Yeah. But we're one. There are millions and billions of other lives. And then we're one planet in this entire known, let's not count the unknown universe. And that, for some reason, is very soothing to me. I don't know why.
That's why I love you, because just like a month ago, I was sitting by myself at one of my favorite cafes, Coast on Cascade, and eating my English breakfast, which I also adore. And there was a table next to me, and my sister actually happened to be in this meeting, and they were like discussing something and like worked up about not meeting a deadline or something. And then they like turned to me and asked me something. And I'm like, ultimately, just don't worry about it. We're all going to die at some point. It's all going to be over. And all these people and like maybe for another generation will be remembered. Maybe, I don't know. But then that's it. So part of it, I think, is not being so apocalyptic where you just like end up not doing anything with your life. But also keeping that in mind and sort of grounding yourself and saying, okay, like if this doesn't get done, like the world isn't going to fall apart. My life is not going to fall apart if this doesn't happen. And I think when you're so grounded, and also I was talking to one of my friends in Bulgaria. He's the CEO of Teach for Bulgaria. I was describing this, like it almost like felt nihilistic in a way. Like it just felt like I was depressed and like just sharing these thoughts about death and like nothing matters and whatever. And he sent me this article, and unfortunately I don't remember. I'll link it, about how when people come very close to seeing death or destruction or losing something very important to them. And I think collectively, to varying degrees, we've sort of seen that with the wars and in Artsakh and subsequently the invasions that have happened in recent years. When you come close to these kinds of things, it really changes the way you think about the world and about where you spend your time and your priorities and how you lead teams or how you're a part of a team and what you want to be working on. And yes, you're like maybe more morbid in a way, but in another way, you're more pragmatic and you're more focused and you're more attentive to things that are actually important to you and matter to either you as an individual or to your family or to your team or to the, the work or that you're doing or the problem you're trying to solve. So I exactly know what you mean, because it's not like it's depressive. It's more like we've seen really rough things, and like ultimately, here are the things that truly matter, like this butterfly and this ant and this person I'm about to talk to in this session in Lori. And then everything else ultimately is not that important, and that's how you are able to move forward in a very complex sort of environment.
The other thing is, kids talk about death. What is death? Where does it come from? And one of the things I talk about with my son is, because how do you answer these questions? But, your fingernail probably has an atom from the claw of a triceratops that lived how many millions of years ago. And he's like, well, what happens when you die? And I'm like, well, maybe part of an atom or your atom from your bone will go to Saturn one day, right? And like these connections, right? And in a way it's deflecting, but in a way it's explaining that things are connected and that there's a larger context, right? And so for me, in a way, seeing things in that big way is, again, soothing, calming, grounding, increases the denominator, or changes the denominator, the context of what we're doing or what anybody is doing. Your career has been mostly in the US and now you're in Armenia. We've already touched on this a little bit, but like obviously there's difference and clashes between how things are done there and how things are done here. What do you like? Has there been a time here in your recent like few years of work that you've been on the ground, where you're like, I really fucked up here. Like I came with this mindset from the US. Like, was there an experience where you were like,
I didn't understand I thought I was proposing the right thing or whatever. I was doing the right thing. I was leading the conversation in the right way. And then I'm realizing now that I was wrong. And like, it's almost like a humbling, like I've had moments like this where I've been like humbled a lot. And my Western sort of like American mindset was questioned in a serious way. And I think once I processed it, what we ended up with was a mix of something globally recognized and practiced, but contextualized into Armenia. Like, has that happened to you? And how do you sort of like merge the two worlds that you're from?
Humbling happens all the time. I'm sure there are major mess ups that I just haven't identified. Probably some of the, but I think in terms of like one episode that was like that big, I can't really think of. There were
micro humblings.
I think there were like, if we can like talk about a learning thing, right? So we always talk about stakeholder engagement, right? And some years ago, we started, even before I moved, a group of us, this work around trying to understand the current status of the healthcare system, especially with regards to primary care and where there was room for improvement. And there was stakeholder engagement initially, and then it kind of petered off, and it ended up being a bunch of us who were not currently living here or from here. And then we continued to do the work thinking that we're doing the right thing. We're going to keep going through all these levers, and we're going to keep doing all this work. And an amazing amount of work went into it. And I would say that mine was the minority, right? Like, other people did massive amounts of amazing work, data collection, talking to stakeholders, et cetera. But in the meetings where things were being discussed and processed and analyzed, the local stakeholders had stopped coming. But what that produced was this list of recommendations that then local stakeholders had to work on. And we pushed for like months for these lists to get worked on. And I remember being frustrated at like, why isn't this happening more? Like, why isn't this being picked up more? And, kind of like a ton of work went into this. And now it's not going anywhere, and da-da-da. And finally I realized, because we broke the cardinal rule. Once the stakeholders themselves stopped being in the assessment, they were no longer engaged. So we created something without them, and we're basically trying to now impose it. Now, this is a way oversimplification, right? Way oversimplification, but because there was some stakeholder involvement, et cetera, and agreement and all of that. But all along, we just pushed through thinking we were doing the right thing. We pushed through and put tons and tons of effort. Again, not just mine. Like, mine was minutia compared to other people's. But then wondered, why isn't this working? Mm-hmm. And it was a combination of, we want to do the right thing. We're well-intentioned. We have the time and the resources right now to be doing this. We're being encouraged by the stakeholders to do this. They're saying they want us to do this.
But they weren't part of it.
But they had stopped being a part of it. And then, lo and behold, there's this like blank wall of, what is this? And I think if we did it again, I don't think we did necessarily the wrong thing. But I think if we did it again, if I were in that situation again, or if I lead a project, or I'm one of the co-leaders, or if I'm part of a team where we're doing that and the stakeholders drop out, I'll be like, done. We're not doing this. This is not.
That's so important.
We're not doing this anymore, because it's not going to go where we think it's going to go.
Yeah.
And I think for me, it's, I still have trouble saying no to projects, but don't even look at me that way.
I know.
But
thanks for that, though.
I think before I was like, this is such a great idea. I want to do this in Armenia. I want to do this and I want to do that. And not only would I spread myself too thin, which would then I would frustrate myself more than I do now, but a lot of them wouldn't progress forward. Some of them because of me, some of them not because of me. But now I'm like, you know what? I'm not even going to get involved in that. I'm happy to meet with this person who doesn't have, wants some context and whatever, and I'm happy to meet with them, but I'm not getting involved because I can see that this is not it's not going to go anywhere. Or chances are that it won't. You never know, right? But based on my experience discussing with colleagues and friends who have more experience than I do in different sectors, this is a 90% chance this is going to fail, and I just can't put my time into this more than just kind of supporting as much as I can, but from the outside.
I have to say, I've noticed that our government is a lot more open to soliciting feedback, for example. I don't necessarily think it's co-creation, but I think at least there's like an opportunity to provide feedback on new policies or laws that are coming out in different sectors. And I think that's a very good step.
Right.
But you build investment and ownership within your stakeholders by inviting them into the process.
Yep.
Whether it's drafting a new law or introducing, I don't know, a new change into a school or a clinic or whatever, I think the more people can be part of that decision-making process, the better. I mean, I sometimes struggle with this just within my own team. You know, sometimes you have to act really fast and you have to make a decision and you have to move things forward, and then you don't always leave enough time for feedback and sort of reflection, and then people sometimes resist that decision because they don't feel like they were part of any part of the process. I don't also believe in taking collective decisions for every single thing because I think that slows a lot of things down, and there are people who are in certain positions who get paid a certain amount of money to make those decisions and carry a higher level of responsibility. And so, yeah, I'm not a sort of a collectivist in that sense, but I do think that like working collectively from our different positions as a team or as stakeholders is super important, and really just increases the chances of whatever you're working on succeeding. Because as you said, like what you were putting together was actually not bad. It just like ultimately flopped because it didn't have the engagement that it needed.
I think you kept repeating the word team. And this week, especially the second half of this week, for some reason, I've realized I really miss having a team. A team in the way that we used to have it. Like there are people I work really closely here, but we're like dyads. But we're supposed to be a group of 4 or 5 or 6. And there's somebody else who sees the work the way I do, and we are able to bounce ideas off of each other or reflect. But I miss having that team, like especially when you're trying to change something. A representative from every group sitting down and being like, how do we do this? How do we do that? What do you think about this? Or this is the strategy, even if it's like my boss, right? Saying, okay, we're going into this meeting. This is the strategy that I'm taking. Are you good with that? Okay, let's take this approach. That open communication, I really miss it. And if it weren't for the people who I have the dyads with, I think I'd be in those funks much more often.
Yeah. That's why I think the learning communities we're building, or like, you know, through Health for Armenia or Teach for Armenia, or I'm sure other programs are doing this too. I think that's one of the assets of these programs. It's not just the training and like the connection to mentors, et cetera, that they get, but it's also just like having that team around them. Even if you're dispersed through the country, like you have a group of people.
You have a network. You have a shared language, and you have transparency.
Yes.
And you have honesty. And I can say, hey, Larisa, you said that, and I kind of see that, but I actually think it's different.
Yeah.
And that's okay. And you can be my boss.
Okay.
Or I can say, hey, you know what? I did this, and I think I messed up. And you go, hey, you know what? You actually learned because you messed up. Great. Let's think about how we can do it differently. That I miss that. And I'm not saying it's perfect. I've definitely been in teams in the US where that did not exist.
Yeah, same.
But the fundamental teamness worked better than it does here. And I keep wondering, okay, maybe my assumption is wrong. Maybe it doesn't need to be that way. Maybe this way works, right? So I go back to what I said before. Is it showing an outcome? Is it as effective? And the answer keeps being no. We keep having to go back because the team didn't come together. The team didn't discuss. So we have to go back and fix this. We have to go back and fix that. Can I go back to your other question?
Yeah,
the humbling question? So we do a lot of screenings in Armenia, some of which are evidence-based, and some of which are not and probably cause more harm. So I know that that concept for a lot of people is difficult, but poor medicine causes harm. We have a lot of poor medicine in Armenia, unfortunately. And so we were having this discussion, and I was in a bad mood or in a funk already. And with somebody who I generally really like and respect, I got into it about this screening, and I started raising my voice, which...
No.
Yeah. And I stopped taking into account local context, local concerns, et cetera. I really was an unpleasant person, and I was very annoyed in the conversation. I think we triggered each other, and so the conversation escalated. But
Was the other person a man?
No, the other person was a woman. But I really ended up being really unhappy with who I was in that conversation. And I went back and I apologized. I tend to do that.
How did she take it?
She took it well. And then we had a really positive conversation about things, especially, and then pulled up the data, et cetera. And I think those humbling things are really important, because then you go back and you say, okay, I need to shut the F up and, close my mouth and go
you can say bad words
Can I?
On this podcast. Yeah.
Oh, good. You tell me that now? We're like...
I tried to model it
once, but then I wasn't sure. Yeah. No, I think it's really important. And as much as I felt really bad about it for like weeks, to be honest, I reminded myself of that whenever I start to get pissed off and be like, okay, don't make that same fucking mistake again. Shut up, go do some reading, and then come back to it. I'm sure I'll make the same mistake again, but hopefully it's less and less.
I think that's also not common in Armenia, to just be able to say, listen, I'm so sorry. Like I reflected and I realized I was really wrong, and I'm sorry. Like
I went back into a pharmacy once and said that to the workers, because I felt really bad, because I'd gotten really pissed at them because they were making a dumb mistake. I felt really bad, so I walked back in and I said, I'm really sorry.
Really? How did they take that?
They were shocked and then just started smiling and said, no, it's okay. And I said, well, this is why I said it, and blah, blah, blah. And
yeah.
They were like, okay, you're right. But they didn't say you're right, actually, although I know I was right. But the way I communicated it was not okay.
What was also interesting for me, like when I first arrived to Armenia, I would be in these meetings and I'd ask a lot of questions. And I'll never forget one time I was in a meeting in one of the regions with like the head of the education department. And I was just asking one question after the other, just trying to like really understand the context, the problem, like whatever we were trying to solve together at that point. And as I left the meeting, the department head's second person came up to me and said, can I tell you something? And I was like, sure. He was like, when you ask so many questions, it just makes it seem like you have no idea what you're doing. Like, don't ask so many questions. You're young. I understand you're inexperienced. Just my advice to you, next time, don't ask so many questions. Always have an answer prepared and ready to go for whatever is asked. And I found that to be so interesting, but I do see it. Like, it wasn't just there in that meeting or in that region.
This is part of the problem.
Yeah, it's just asking questions is perceived as weakened leadership, when really I think it's the opposite.
Right. Yeah, it's a significant part of the problem, I think. Again, that transparency. Why would you hide that? I mean, you're not showing anything. You are, by asking questions, we are engaged. We're trying to figure out why this, why that. And actually, going back to the 5 whys, right, when we think about improvement methodology, that's exactly what you should be doing to try to figure out how to make something better or how to change something, or if it needs to be changed. Not saying something is why you end up with having 70-page guidelines that nobody can follow, but 100 hours went into them because of exactly that. And it's interesting, though, that person articulated it, right? That's one of those assumptions that I'm not surprised, and I've heard that before, but it's something you kind of have to learn when you come here, right? At least from the U.S., because in the U.S., you're encouraged to ask questions up to a point, right? Like meetings have agendas, right? You can't ask 4 hours of questions, but it's definitely part of the framework here. There are other, similar things. So we were in this meeting, and working on this document that an expert had written. And I kept saying, but we really should be focusing on the content. And the coordinator or the program manager, I don't know the exact title, kept saying, but this is the content, and was going over every sentence, right? And changing the language to be more intelligible, which was a good thing because it's not useful to have an unintelligible document, right? But I myself and others kept saying, but we want to focus on the actual content. We kept getting ignored. And then finally at the end, it was supposed to be a 2-hour meeting, and an hour and 40 minutes in, the first 20 or 40 minutes of which we only discussed the title, I said, no, but I want to talk, can we talk about the content? And I got the same response. And I said, for example, and gave some of the medical components that I had questions about or that I thought maybe we needed to discuss and change. And this coordinator said, but that's the content. And I was like, yeah, that's what she goes, that's the medical content. I can't help with that. I go, yeah, but that's what I've been trying to say. So later I asked my friend who was in that meeting, and I said, how come I couldn't get my question across? I know it wasn't the terminology because other people were saying the same thing with the same terminology. She goes, you want to know why? And I was like, why? And she goes, because that person can't fathom that the expert who wrote the document could be wrong about something. And it blew my mind. It blew my mind because it's an assumption on my part, right? Like, you've called people here together to work on this document. Obviously, there might be issues, right? Or it shouldn't be one person who writes a document. In the US, in Europe, you have consensus statements around things, right? People sit around a table and work on things together with feedback. And it just blew my mind. First of all, that there could be one medical fact about something, right? That there could be a medical statement or recommendation could be debatable, right? But also that this person is infallible. They are the end-all be-all of that medical condition in Armenia. It goes back to it. So when Noyan Daban used to be on Avovian, I remember you'd go upstairs and there was a brown bookshelf and all the medical books were there. And like the main book on peds GI or peds pulmonology, and I would take a look, I would kind of leaf through and there'd be a professor doctor, right? Like the head person would have written a book about it. Thick ass book about some topic without a single citation. I said it's based on my experience, and so it shall be, and so it is the truth. You can't provide good healthcare based on that because there leaves no room for learning, adaptation. There's no data. It's just what somebody said. But we are still in that to some extent. I see a lot of change with this kind of generation now, which is great. But we still have that mentality in our structures.
And are our universities, are they research universities, any of them, or no?
Medical? We have one medical university. We have other medical schools. And there are a lot of political and quality issues around that. And how do you determine that in an objective way? But some of them do research.
Okay, that's good.
But the way I think most of the time, there are some really high quality researchers in Armenia. But most of the research that happens is not on the same level. But it's getting there. Mm-hmm. It's getting there.
So how are you feeling about like the trajectory of the healthcare system in Armenia? I'm not going to ask about Armenia because that will be a very political question at this moment as we're recording this. But
I mean, like you said, I think the fact that we have opinions are being asked is huge.
It's the first step.
It's a first step. Somebody says, hey, could you provide feedback on this? Now, I might be frustrated that I think the format or the form of it, the structure of it is not implementable, that that it reiterates the same kind of problems from before, that it's going to have minimal impact, or that, my concept of a team is very different. So I get frustrated by all those things I think we've heard over the past hour and more. But the fact that somebody said, hey, can you take a look at it? And that I get to interact with other people who've been asked, and I get to kind of be like, hey, what if we did it this way? Or what are you basing that on? Where's your study? Here's my study. Where's yours? I'm not saying it because I'm an expert. I'm saying here are 3 studies or the recommendations of 3 different countries who all say this. Mm-hmm. If you want to do something different in Armenia's document, that's fine. Mm-hmm. But show me your data. I'll show you yours. If you show me yours, I'll show you mine. Type of thing. But then there's nothing. Well, that's a problem, right? So that type of interaction has so much value. And, one of our colleagues said, we're not going to change it in our generation.
No.
We have to prepare the next generation to do it. And I think that framework shift was really important for me as well. It doesn't mean we stop working with the structures we have now or on the projects we have now, but a lot of it is about the learning, is about the modeling, but that's actually an overstatement. We can model, I can model, you can model what we've learned in the US all we want. It won't be effective. We need to model taking an outside framework and integrating it and adapting it and contextualizing it to the right context here.
Absolutely.
So I think that is one of the most important things, is one of the most important things, whether it has to do with helping develop and support the future leaders here or the young diasporan leaders who are going to come here, right? If we can stop the next generation of diasporan Armenians from buying more MRIs and building more buildings and putting more hospital beds and getting them to work more on the system, the less sexy side of things, that's a significant impact.
I was just touring the U.S., actually. I went to New York, Boston, Los Angeles, and SF, and I met with more people like our age, like 30s, 40s, 50s. And I have to say, especially the 30s, 40s, nothing against the 50s, they are gravitating more towards these kinds of solutions that are less glamorous, less sexy, because it's not a building, it's not the next machine, it's not a diaper drive, it's investing in human capital development, which I think is exactly what Armenia needs. And it's less, maybe it's harder to showcase. It's much longer term, but I think it's the only thing that will propel Armenia into a good direction ultimately. And so I have hope. I don't necessarily have hope for some of the older generations. We should be thankful to them for what they have done and for what we have now, which is some great things, but also some, I'm not blaming them for all the bad things that are happening in Armenia right now, but part of it also, we talked about this, but some of the system isn't working also because of some of the choices that our diaspora has made. So I take that back. I will put some of the responsibility on you too. But I think the younger people are looking at this and saying, okay, it seems like the smarter investment right now is to do these other things.
Yeah. We should be looking at, if you're donating from Armenia, first of all, the question is, what is the problem you're trying to solve as a diasporan? Are you trying to solve your own identity issue? Are you trying to prove you're a good Armenian? Or are you trying to say, hey, I might have some skills or resources, connections that could help improve outcomes in some dimension or field or whatever in Armenia? Let me see how I can best do that. For some people, it might just be, you have a network that can be used, or you work in an institution and there are experts. They may not be Armenian, but maybe that's the best thing you can provide. But that's what's important. It's not whether or not you come as a physician and see 30 patients a day or 50 or 300 and then you feel great, because oftentimes that causes more harm. So we've got to figure out, okay, if what we're trying to do is help facilitate, improve outcomes, right? Again, going back to what is the problem we're solving? Improving outcomes, building a healthy nation. Then let's start with that and go backwards. And that applies to whether or not it's work with ministries or NGOs on the ground in Armenia, right? It's not about putting a check mark or a ptichka or building a building or saying that we made more beds in the case of health or schools in the case of education, I would guess. But really, what do we need to do to improve the outcomes and working backwards from there? And part of that, again, might be building infrastructure. I'm not saying it's not. And in many cases it is, but that's not the end point, right? That's a mechanism. But it's also true, so not just within for institutions, organizations within Armenia, but especially true in the diaspora. And the diaspora has a responsibility to model that. The diaspora has the opportunity and therefore the responsibility to say, yes, I have these resources, but guess what? I'm going to model it and say, no, you don't need the 40 millionth MRI in Armenia to show a lumbar herniation that actually is not symptomatic, that's going to lead to an unnecessary surgery, that's going to change someone's quality of life for the worse, but to say, we want to help you build systems. Or your greatest cause of premature mortality is cardiovascular disease, and that's where we want to put it, and we were going to focus on prevention. And every diasporan doctor is going to say, we need to improve the smoking rates, or we need to reduce the smoking rates. We don't want to make them higher, we want them lower, right? Or that we are going to have an expert committee on this, and we will help support you on that and learn how to work with each other on that, instead of
So basically invest in primary care.
Totally unbiased.
Totally
unbiased, yeah.
Dr. Lorky, my friend, thank you so much.
You're very welcome.
I feel like I could talk to you for hours. I'd love to have you back sometime soon. And I just think you're one of the most brilliant minds Armenia has today. I know you're going to kill me for saying this, but thank you for everything you're doing. Thank you for working with me and our friends at Health for Armenia on this new organization we're launching later this year. And just thank you for being who you are and for being awesome.
Thanks for having me. Love you too.